Hello, my name is Melissa Fombrun, and I'm going to be talking about brain tumors. A brain tumor is a mass or growth of abnormal cells in the brain. Some tumors can be benign, which means that they're non-cancerous, while others can be malignant, which means that they're cancerous. Brain tumors can be classified under two categories, primary and secondary, and we'll talk about that later on. Now, types of brain tumors. There's over 100 different types of brain tumors. Usually they're named by the area that they invade or the cells that they come from. So here are three examples. There's a glioma, which is a tumor of the glial cells. There's a pituitary adenoma, which is a tumor of the pituitary gland. And then there's a meningioma, which is a tumor of the meninges, which is the covering of the brain. Now, rhyme or reason. There is no rhyme or reason for tumor growth. They affect people young and old, men and women. They are, however, more common in Caucasian ethnicity than any other race. Now, according to the National Brain Tumor Society, in 2013, an estimated 69,720 new primary brain tumor diagnoses will be made in the United States. Over 24,000 will be malignant, while over 45,000 of them will be non-malignant. Now here we are talking about brain tumor classification. As I mentioned before, they can be classified as primary or secondary. Primary brain tumors is where the cancer begins in the brain or in tissues close to it, as opposed to secondary brain tumors is where the cancer began elsewhere in the body and spread to the brain. Now the two most common brain types of cancers that spread to the brain are the lung cancer and breast cancer. Signs and symptoms. Detecting signs of brain tumor depends on the size of the tumor as well as its location. Most common signs are headaches, seizures, weaknesses on one side of the body, differences in personality or memory changes, vomiting, confusion, double vision, numbness or tingling are also quite common. There's also changes in hearing or differences in taste or smell. Now I'm going to mention the pituitary tumor specifically because that tumor caught my attention since we covered the pituitary gland so extensively, and we learned all the hormones about all the hormones that are produced in the pituitary gland, and of course the two other ones that are stored in it. So in reading the symptoms of the pituitary tumor, it all kind of made sense to me, based on, all the hormones and all the symptoms go along with the hormones that are in the pituitary gland. So here are a couple of the symptoms. There's low blood pressure, obesity, excessive body hair, facial changes. There's also changes in hormones, menstrual changes, or loss of menstrual periods in women. So those are just a few. I just thought I should mention it since we covered the pituitary gland. Now, diagnosis. There's right here, what you're looking at here is one on the left-hand side is a CT scan, and on the right is the MRI. Both of them are used to diagnose brain tumor, but the MRI is a little bit more detailed. It's more of a 3D image. So as you can see the tumor a little bit more than the CT scan. There's also a brain tumor biopsy that can also be done. This is where a sample of the tumor is extracted, and a pathologist analyzes the sample to determine the type and grade of cancer, or type of grade of the brain tumor. Now, treatment. Treatment depends on a number of factors. There's the type of tumor, whether it's malignant or benign, its location, its size, also the patient's age, and the patient's general health. Now, here are the treatment options. There's surgery, radiation therapy, chemotherapy, and angiogenesis inhibitors. Most people receive a combination of those. Now, surgery is the primary and most invasive treatment. Most benign tumors are treated by surgery. Most malignant tumors require further treatment. So, in addition to surgery, they will have radiation and or chemotherapy along to help kill the remaining cells, if there are any. Now, radiation therapy uses high energy radiation to shrink tumors and kill cancer cells. According to the National Cancer Institute, about half of all cancer patients receive some type of radiation therapy during the course of their treatment. Now, chemotherapy uses drugs to kill or alter cancer cells. Now, it is not an effective initial treatment for low-grade brain tumors, mostly because of how the brain protects itself. It's very hard for the drugs to actually penetrate the brain and access the tumor. Also, not all types of brain tumors respond to chemotherapy. Chemotherapy, as I mentioned before, is also used after surgery to kill any remaining cancer cells. Now, angiogenesis inhibitors, most people probably don't think about that as a treatment when they think about cancer, but um, angiogenesis is well, let's talk about what it is. It is the formation of new blood vessels, and it is essential for the growth of brain tumors as well as the metastasis of cancerous tumors. Now, metastasis is the spreading of the cancer. It provides the necessary nutrients and oxygen needed for the tumor to grow and invade nearby tissues. So preventing angiogenesis is extremely important in treating brain tumors. Now, the two main drugs used are Avastin and Infinitor. There are others out there, but those are the two main ones. And these drugs help to starve the tumor of nutrients and oxygen, and hopefully the tumor will shrink and, of course, die. And that's it. That's all I have about brain tumors. Thank you for listening.